Hypoglycemia and diabetic ketoacidosis, DKA, are two distinct conditions that can occur as complications of diabetes, each with its own set of challenges and risks. Hypoglycemia is characterized by abnormally low blood glucose levels, leading to symptoms such as shakiness, sweating, confusion, and in severe cases, loss of consciousness or seizures. On the other hand, DKA occurs primarily in individuals with type 1 diabetes when the body starts to produce high levels of blood acids called ketones, causing symptoms like excessive thirst, frequent urination, nausea, and fruity scented breath. Prompt treatment for hypoglycemia involves the quick administration of glucose or carbohydrate-rich foods, whereas DKA typically requires hospitalization for fluid and electrolyte management, insulin therapy, and monitoring of vital signs. While hypoglycemia is often a risk for those who take insulin or certain oral diabetes medications, DKA is more common when insulin is lacking, during periods of illness, or when blood glucose is not adequately controlled. Here's a detailed look at each condition, emphasizing the importance of understanding the symptoms, prompt treatment, and preventive measures to maintain optimal health. Primary cause: insulin excess versus insulin deficiency. In the contrasting realm of diabetes-related complications, hypoglycemia and ketoacidosis stand at opposite ends, fundamentally differentiated by the availability of insulin. Hypoglycemia is a condition resulting from an excess of insulin, leading to dangerously low blood sugar levels. Symptoms often include shakiness, sweating, confusion, and in severe cases, loss of consciousness. On the flip side, diabetic ketoacidosis, DKA, occurs when there's a deficiency of insulin, typically linked to type 1 diabetes. The body starts burning fats at an unsafe rate, producing ketones and causing blood acidity to rise. This can prompt symptoms like fruity, scented breath, nausea, and deep, rapid breathing, culminating in potentially life-threatening biochemical chaos if left unaddressed. Understanding these underlying mechanisms is pivotal for prompt and effective treatment. Hypoglycemia demands quick sugar intake, while DKA requires insulin administration and fluid replacement to revert the metabolic disarray. Blood glucose level, low versus high. Hypoglycemia and diabetic ketoacidosis, DKA, are both acute complications of diabetes but with fundamentally different pathophysiologies. Hypoglycemia, characterized by abnormally low blood glucose levels, often triggers an immediate physiological response including sweating, trembling, and confusion, as the body lacks sufficient energy to function. Without prompt treatment, severe cases can lead to loss of consciousness or seizures. In contrast, DKA, usually associated with type 1 diabetes, involves very high blood glucose levels coupled with a severe lack of insulin. This deficiency leads to fat breakdown and an accumulation of ketones in the blood, resulting in symptoms such as deep, rapid breathing, a fruity-smelling breath, nausea, and potentially life-threatening dehydration and acidosis. Management strategies differ significantly, with hypoglycemia being addressed with fast-acting carbohydrates, while DKA requires insulin administration, fluid replacement, and electrolyte management. Acid-base status: normal acid-base balance versus metabolic acidosis. Hypoglycemia and diabetic ketoacidosis, DKA, represent two extremes in the spectrum of blood sugar dysregulation, often observed in individuals with diabetes. Hypoglycemia, characterized by abnormally low blood sugar levels, typically does not directly affect the body's acid-base balance. It can cause symptoms like tremors, sweating, confusion, and in severe cases, loss of consciousness. On the other hand, DKA is a state of metabolic acidosis, resulting from the accumulation of ketones in the blood as a response to insulin deficiency. The body, unable to utilize glucose for energy, breaks down fats, leading to an acidic environment that can manifest in deep, rapid breathing, fruity-scented breath, nausea, and profound lethargy. Distinguishing between these conditions is crucial as they both demand immediate but distinctive medical interventions. Symptom onset: rapid versus gradual. In the complex landscape of diabetes management, the sharp contrast between the rapid onset of hypoglycemia and the more gradual creep of ketoacidosis is pivotal in clinical decision-making. Hypoglycemia strikes like a bolt of lightning, with symptoms like shaking, sweating, and confusion demanding immediate attention to raise blood sugar levels. In stark contrast, ketoacidosis, A dangerous buildup of acids in the blood emerges more insidiously over hours or days, presenting with deep, labored breathing, fruity scented breath, and a profound sense of fatigue. Recognizing these temporal signatures is critical. It aids healthcare professionals in diagnosing the condition correctly and prioritizing life-saving interventions, balancing the body's delicate metabolic equation. Ketone body presence, absent or low versus elevated. Hypoglycemia and diabetic ketoacidosis, DKA, are two distinct conditions, with the presence of ketone bodies playing a significant differentiating factor. In hypoglycemia, the main issue is an abnormally low level of glucose in the blood, which does not typically result in elevated ketone bodies. The signs are often related to an inadequate supply of glucose to the brain, including confusion, sweating, and tremors. On the other hand, DKA is a serious condition usually seen in type 1 diabetics, where a lack of insulin leads to an over-reliance on fat for energy, resulting in the production of high levels of ketone bodies. These ketones contribute to the blood's acidity, leading to symptoms like deep, rapid breathing, a distinctive fruity breath odor, and altered mental status. Therefore, measuring ketone levels is crucial in the differential diagnosis. Lower absent ketones suggest hypoglycemia, whereas elevated ketones indicate ketoacidosis.